This is Module 7, Lecture 1. This is like an introductory primer to developmental kinesiology. And when we look at developmental kinesiology, this motor development perspective, we're looking at how we acquire our skill sets from birth until our maturation. Where this lecture and where this topic really goes in a kinesiology perspective is this aging process, or hopefully successful aging, right? And what we want to look at is how we go from pre-puberty, childhood, our acquisition of skills, through puberty, into our adulthood and our sexual reproduction era and our peak time, and then this aging gracefully component. We want to look at is like the average age of our population, where we're going as a society, our next level of event, and how can you live to 100 years old, and instead of looking at just quantity of life, also considering quality of life. So the first thing we look at here is understanding what motor development is, and this text is coming more from the chapter, so this is more kind of a primer into the chapter summary, but looking at some of the descriptions, looking at this concept of growth and versus maturation. So looking at the quantitative increase of size and structure. So gaining a few inches in your height, adding some pounds of lean body mass. The maturation is the refinement of that tissue over time. We're looking at learning, which we talked about in the last module. Heredity, looking at the genetics, things that are fixed at birth, your genetic aspect, things that are within your control or not within your control, the epigenetic and the environmental influences on those genes, and then the outcome of those developmental components. What we want to look at is this age component, and there's a big discussion within the holistic or wellness aspect of this chronological age, where your every trip around the sun grants you one more year in your actual biological age. So what level of development or maturation are you? Or from a other end of the spectrum, looking at, yes, you might be 45, 55, 65 years old, but your cells and your physiology is functioning that of a 30 or 40-year-old. There's people that I've met that are in their 20s and 30s that have the physiology of someone 2 or 3 decades older. And there's people that I know in their 60s and 70s that are kicking butt and taking names, and their physiology is that of many decades younger. And yes, a lot of that can be attributed to genetics, but most of the research coming out is genetics play about 20 to 25% of that. So that means a majority, 3/4 of that is within the control of lifestyle factors. What habits, what things are you doing to your body now that are having a payout long term? So when we look at stages of development, this is based on chronological age, but hopefully reference to biological age as well. But there were only 2 age categories. You had your childhood, which was 0 to 7, and then adulthood, 7 years. So at 7, you are expected to be a functioning contribution to society. And in fact, 7 is about the time where you have reached physical maturation, where your gait, your steps, the way you stride, your steps hitting the ground, your running is about mature. So like you wouldn't expect a 6-year-old to be able to have a normal running gait, but a 7-year-old would. And that's also the time at 7 years old where mentally you become fully conscious. And if I were to ask you when your earliest memories are, most of you would have some obscure memories for like first grade, and that's about it. And then you would have more solidified from like first grade on. But try to ask you if you have memories from 3, 4, 5 years old. Definitely nothing before 2. Now you might have some outliers where you remember 1 or 2 things, but most people don't know. Like your conscious mind comes into full effect right around 2 years old, and you're in this lucid state until about 6 or 7. So 7 years old, tied to maturation of gait and developmental consciousness there. Currently, we have 3 tiers. We have the prenatal, so the embryo, so conception to infancy. You have childhood, the toddlerhood to pre-adolescence, and then you have this adolescence going from this child to adult. And you can kind of see the stages here, these developmental components that are given here. And so we give these milestones that need to be reached, different cognitive processings that need to happen just to stay on track. There's a range that exists here. And if ranges aren't met, or if benchmarks or key milestones aren't met, then there's concern for intervention to make sure that our development is on speed, particularly here early on. If you miss that window of walking, that ability to walk drives, that motor drive drives neurological development. And so if there's a delay in walking, there's going to be a delay in cognitive processing or other abilities. So it's really important to get the kids up moving as within the time frame as best as possible. So when we looked at the motor learned development from last lecture, we looked at that movement was a product of your task, your environment, and your resources. And it's the same three factors that drive human development when you're born. So really, we develop with this trial and error effect. We don't take in consideration how often we fail when we start walking as children in the first steps. But all human movement is driven by the emotional needs of the child and what they visually can see. And all this is done under gravity. So when we look at this task environment, the individual is this infant that doesn't know anything besides crying, pooping itself, and how to nurse. Outside of that, everything that you can do today, you had to acquire through trial and error, through emotional needs, and then following that whole hierarchy or that learning process of unconsciously incompetent, conscious, and driving everything to the subconscious mind. Everything we do, want to do, or need to do early on is to get to the standing posture. Children are curious. Once their vision starts to come in and they have good head control and they can focus on things, they want anything they can see they want, and they're gonna, if they want it bad enough, they're gonna try to get it, and they're gonna be persistent with it. And at first they can crawl, roll to it. Eventually they go from crawling to standing and walking, and from walking, like Frankenstein, they start walking more like normal children. You have to learn to crawl before you can walk. Crawling usually precedes walking. But these are, when you look at like the whole era of where we're at in the fitness industry, where we look at these primitive movements, primal movements, this crawling, rolling, all these things that children try to do to get to this aspect. There's a whole movement in the fitness industry right now to revisit these primitive positions, these developmental positions. And these are just what the baby or the child had at the time. I think it, like when you look at your human development or our standard aspect, standing and walking are our two fundamental movement patterns that from any kind of practitioner, whether you're a physical therapist or a strength coach, trying to relate all human movement back to these two primal movements, probably the most effective way you can for treatment and for training. Human development happens under gravity, right? So the force of gravity is what we're always trying to overcome. We do have these primitive reflexes early on to assist with like protection of the child and gait. If these reflexes persist into adulthood, those are usually signs of neurological damage or some other issue. The transitions go from more like spontaneous reactive movement to more intentional voluntary movement, and it's on par with what we see when you're going from novice to expert developmental. The human body does, as we remember from the anatomy and physiology, has the spinal component and these curves of the spine. And you end up from this supine position where you're on your back to being able to get on prone, where you get to your tummy on yourself, into a quadriplegic position where you're, or quadruped position where you're on four arms and legs, and then eventually standing. And again, comes back to that task, individual, and environment. So these are the developmental gaits here. You kind of have this on your back, one curve to the spine. You eventually be able to turn over onto your stomach, and then you get the secondary curve in the spine when you finally get enough head control and posture control. And then you're able to push yourself upright, maybe take some movement, crawling, able to pull yourself up, usually with the help of a table, perfect squat there, walking with arms up in the air, kind of like this lumbering type gait. And then eventually this progression over time, and then about 7 years old, you get these more advanced movements. So that's the process of which we go through. And kind of now that we have an image here to reflect back, this child can easily put their feet in their mouth, right? No problem. And it's because they only have one curve to the spine. You try to get a 25-year-old person on the ground and putting their feet in their mouth, that's going to be an interesting task, right? So to try to make people revert back to these primitive components, the structure is totally different. This whole equation, this individual resources, environment, task, is a different ballgame for each of these children at these different paces. And to have an adult try to revert back to this doesn't make any sense. what you see here are these motor milestones that exist for crawling and for walking. And you can see there's a pretty big range. So between the ages of 9 months and like 14 to 15 months, they should be walking, maybe walk with help a little bit up into 18 months. Still normal, right? So a child that starts walking at 9 months is no better or worse than a child that starts walking at 18 months. It's just every man for themselves, to each their own, right? Depending on what they were focusing on and what environment they're in, or how much emotional desire they have. Some children just don't care. This is kind of what I was referring to earlier with these gait patterns, like using standing and walking as a biomechanical map, because all sport movements are based off of these two fundamental movements of standing and walking. Looking at what is the knee doing, what is the foot doing, what is the hip doing on the right leg during gait. And if those same movements are needed in your sport event, maybe instead of looking at the knee, you can look at the hip and the shoulder and kind of trace these things throughout the body. So that's the acquisition of development. Now we're going to look at aging. And the first thing that comes up is this life expectancy. And there's kind of a, not a lie, but a misunderstanding of average age. And when we look at 2000 BC, so looking at 4,000 years ago, the average age was 18 years old. So when we look at the average age now, roughly now, like 2015, about 78.8 average in USA is 26 in the world. Iceland is number one at 82.8. But it's a pretty significant improvement, right? About a 60-year increase in life expectancy. And when you read this, and there's nothing wrong with the statement's factual. But when you read this, you get this perception that in 4000 BC, that by the time you were 7 years old, you were kind of living your life that was like your mid-crisis lysis, and then you were going to die about 18, 19 years old, and so the average age, 20, 21, and that there was no one walking around with gray hair, that everyone was like 30 or 40 was considered old age. And that's actually not the case. And I'll show a little graphic here in a second. Let's look at some of the numbers here for the life expectancy. So here is of 2014, looking, and even if we pulled up current data, you would see similar trends here. You would see that women tend to live longer than men. And still today, like some of the thoughts were that men were working more and so had more stress and so more cardiovascular disease. In the end, men end up just doing stupider things, right? They are more risk tolerant. They take on more risky jobs, and there's just more deaths. They, die more in crime. They die more in murders. So there's just more violence and aspect there. There's a kind of a leading theory here that's come up a little bit, that the hormonal levels play aspect in that, and the blood levels, and menstruation has a protective effect. So, but there's all different types of components of why, or explanations of why women live longer than men. But it still persists to this day that women have a higher life expectancy than men. But you can see that the United States is kind of right here in the middle. And you can see that, Iceland's, some of these countries here like Japan and Italy have these higher life expectancies. And then you have, on this other end of this, you can kind of look at this and see. But clearly better than 18 years old, right? Even the worst country here, South Africa, average age of like 55 to 60 is significantly better than 4,000 years ago. And you can kind of see over the eons here, over the centuries, looking at the pretty improvement of 18 years old 4,000 years ago, 22, 33, big jumps here, huge jump here between 1900s to 1946, and then continuing on to where we're at now, like 74.7. So what happened, right? What was going on where we had these big jumps? And this is almost doubling of the age, So there's pretty significant improvements. Honestly, one of the biggest improvements that we've had with our life expectancy has been sanitation. So not medicines, or not that those aren't the thing, but just not drinking the same water that we're pooping and spitting and vomiting in, right? That's some of the biggest aspects. We look at a lot of the communicable diseases within the United States. We herald vaccines as the savior, but really sanitation was a huge aspect, right? Having clean water, getting rid of sewage, water treatment. There's no doubt that antibiotics had a huge aspect, and antibiotics, I think, have been one of the largest game changers, right? Like that was kind of right here. This was the big difference here in the 1950s, like post World War I, this big significant increase in life expectancy. happened mostly because of the introduction of antibiotics between the 1940s and 1950s. And that was a big game changer, right? So have a 20 or 30 year. We're kind of due for something like that soon. Now, whether it's genetic manipulation or some kind of protein or protein injection or genetic mapping, whatever it may be, but we're definitely in the era of biohacking and having this component of this next leap. It is expected that we should be living to about 120 years, and we're kind of past due for this next jump. So it's kind of interesting times that we're in. But again, I'll kind of piggyback on what I was saying, that it is kind of misleading that these ages, that there's really no one existing. And really what's happening is, if we look here, are we really living longer? We look at 1907, 1957, and so we look at 50-year intervals here just in the United States. And in 1907, the average age was 45.6 years. 1957, 66.4. Yes, there was the introduction of antibiotics. That was a significant aspect. But from 1957 to 2007, another pretty big jump, right? What also was happening, if you look at infant mortality, 1 out of 10 children were dying, right, within that first year of life. In 1957, 2 out of 10, 3 out of 10, and then by 2007, less than 1 out of 100, and now we're pretty much like 1 out of 500. So back then in 1907, so about 100 years ago, it was expected, like, okay, your child died. Like, it was part of life. So a child dies now, it's kind of a big deal. So what's happened is that our ability for two things has happened, actually. So when you look at our current modern medicine, about 50, 60 years ago, you got a cut on your arm, there's a chance you might die because of the lack of antibiotics. Today, you can cut off your whole finger, and if you put it in a bag of ice and bring it in, there's a chance that they can reattach it, right? You can transplant your face if you wanted to, right? So there's our emergency medicine has become phenomenal in the ability to, the people that normally would have died from emergent situations like falling off a horse or getting struck by something, or you look at most of the deaths that happened in the Civil War, most of those were not because of injuries direct on the battlefield, but injuries sustained on the battlefield and infection later on. So our ability for emergency medicine has been phenomenal. The other thing that's happened is that the amount of people surviving childhood has increased significantly. And as you can see here from the chart, and what I'm going to do is I'm going to pull up a graphic here, an image. Excuse me. So what you have two groups of people, 2 groups of 4, right? A family of 4. And let's say this family of 4 survives, and 60 years, 80 years down the line, you have 4 people that are 80 years old. So let's assume they all started off as kids, right? And if you take the average age here of these 4 people, the average age would be 80, right? So the average age is 80 years old, kind of where we're at today, because most people survive childbirth. You look at this other group over here, and let's say 2 didn't make it past infancy, but these other 2 did make it to 80 years old. So they're all celebrating. Well, these probably not as happy, but celebrating. But if you took the average age of this group here, the average age would only be 40. So to say that there wasn't enough people getting older or not enough, that wasn't true. You look at the founding fathers of the United States, you look at Thomas Jefferson, Benjamin, all these people died in their 80s, right? 86, 87, almost 90 years old. And this is before the advent of electricity, running water, and antibiotics. And so it wasn't that we weren't having old people, just a lot of people were dying young. Death was a normal part of life. So when we see these numbers, of like 33, 33.5, 36, there wasn't old people there. It's just that people were dying younger, so the average age was pushed down. And when you kind of factor for that, when you look at the different calculations throughout history, you're getting 52 plus or minus 15. You look at now 400 to 100 BC, 68 plus or minus 13. So you start to see this like 70 to 85-year-old range. And so when you start to think about it, our life expectancy hasn't changed much over a couple centuries. And it's not that we haven't improved. It's just that as we improved in certain areas, our environment has become more toxic in other ways. We look at up until like 200 years ago, there was no nuclear radiation, no fallout. And we've had hundreds, if not thousands, of nuclear tests on our planet, on our soil, during the up until the Cold War, the chemical byproducts from our processing plastics. I mean, our chemical loads are so high right now, and I'm not saying that we need to abandon all chemicals and petrofuels and start going organic, but there certainly is a relationship between the chemical load, chemical environment. But outside of that, too, the artificial environments that we create, some argue that our environments are maybe too sterile, that our artificial light might be too damaging. I'm actually kind of fond of that theory. But in the end, our medicines have kept up with us, have improved. It would be awesome if we could somehow recreate the environments we had a couple centuries ago with our modern technology now, a clean food, clean water, clean air, and couple that with our scientific advancements. I think we would easily be in 120, 130, 150 years old. All right, so we can't do that. We can't invent our time machine and go back. But what we want to do is, what can we do from this point on, right? Can we can we reduce our toxic load, mental, physical, chemical, environmental, and can we improve our physiology so that we can't control the clock of time? So can we age this more gracefully? And when we look at this curve of aging, you want to age. It's inevitable. It's going to happen. So you want to kind of have this reduction, if you will, over a longer period so that even in your 60s, 70s, and 80s, you're still functioning fine. You don't need a cane, don't need a walker, or so forth. But people that aren't taking care of themselves, sedentary lifestyle, smoking, drug use, overindulgence, so not even use of anything, but overindulgence of that and not enough, too much comfort, not enough physiology attention, you're going to have more of this usual aging plus disease factors. But exercise, movement, the ability to be strong and maintain strength, and eating well, sleeping well, lifestyle habits, these have huge implications. And I don't need to sell these to you. Everyone knows how important or how beneficial exercise and physical activity is. The question is, are we doing it enough? And so that is one of the key factors that lead to this aging gracefully versus these rapid declines. And, the successful aging, this minimizing risk of injury, continuing engagement with life, maintaining physical cognitive abilities. And again, how do we avoid this this rapid decline that tends to happen in the majority of the population? And how do we stay afloat, right? And you can see that it isn't unrealistic to be able to do things that you did in your 20s, 30s, and 40s. And when you look at like some of the, these are guys that are in their 90s that are sprinting, not walking fast. They're getting airborne and landing, right? So they're still competitive, right? The Masters competition. There's bodybuilders that are in their 60s and 70s. And we are moving into that era where we're kind of accepting that the quantity of life, we want to make sure we're living long and do everything to save lives, but quality of life also matters. What's the point of living if you're not moving, right? What's the point of living if you're dependent upon machinery or devices, right? Sometimes we can't control that because of environmental aspects or structural changes, but for the most part, that's our goal. So that's something to keep in mind is that physical activity and fitness is the key to this developmental aspect and to this successful aging component.